I welcome you all to another episode of the Essential Talk. Today, we will be discussing about the pandemic and how it has affected our lives as well as the healthcare system in India. And for the same, we have with us here today Dr. Deeksha Khanna. Hello, ma'am, once again.
Hello.
Without further delay, let's begin, ma'am. We have seen a lot of lapses. We have seen a lot of lapses in
Yeah.
the healthcare industry during the second wave itself. Do you think that India needs a healthcare reboot?
Definitely, healthcare system in India needs a very a big reboot in terms of three major key points that I would really highlight that we all learned from the pandemic. First was the accessibility, second was the affordability, and third was the availability. We all saw non-availability of the drugs. We all saw non-availability of beds. We saw on non-availability of oxygen cylinders. Second comes again with affordability that is there that was not there in the system in the healthcare system during the second wave. Not many could really afford the oxygen cylinders. Not many were not from a good economic background who could really support and get the affordability and the accessibility. Many were not really maybe accessible even to the hospitals, the transportation, even the ambulances that we saw
Oh,
that time were really less in numbers, and that was also a big reason for a lot of number of deaths as well. I would like to share an event based on this, a real life event. The patient was COVID positive, and the shortage of ambulance led to the death of the patient itself in the home. So that is what could have been prevented, and it have been prevented. So yes, with these basic features, the healthcare system needs to really work on it.
yeah, I totally agree with you, ma'am. So, what practices do you think we can incorporate in our day-to-day lives to avoid all this from happening? Right.
See, firstly, it's all basic. Firstly, it's basics. It's the hand washing techniques that WHO has recommended us. It is 7 basic steps. It doesn't take around. It just takes 30 minutes for us to 30 seconds. Sorry, 30 seconds for us to do hand washing. That is the main. Secondly, we all should be wearing masks. Third, we should be carrying our sanitizers. And lastly, last but not the least, we should all be concentrating upon our vitamin C, our multivitamins, and additionally, I would add the exercises also that also boost your immunity, and some sort of personal touch. If you are happy, happiness
Mhm.
does boost your hormones, and they keep you fit and away from all the problems. So that is the basic that we can all do. And
Yeah,
yes,
that.
of course, social distancing. I
Mhm.
know it is difficult, but let's try let's try doing it.
I totally agree with you, ma'am. It's like really essential at this point of time, right? So, like you pointed out, the happiness, right? So, opposite to the contrary to the happiness is the stress, which everybody is undergoing, and specifically, I would like to give a hats off to the medical staff and all the health workers in that team. So, we've all seen that in the pandemic all the healthcare workers, including the final year students as well, were called on ground to tackle this heavy battle between the COVID and us, right? So, how did you all manage to cope up with all the pressure, the stress that was undergoing at that point of time?
Um, stress was more than what we are born and brought up with. Once we are doing our MBBS or medical studies, we are always born and brought up with the stress. So we are generally very used to it. But yes, definitely, this time exceeded the stress level. So what we as medical professionals were doing was counseling each other. Secondly, there was an emotional support from everybody around for us. Thirdly, all the sympathy that was there was keeping a boost, keeping stress away. And then yes, we were with each other at every point of time, wherever we used to see that one person is going down and something is happening. So we were all there as a team, and I would say as a family more, to bring down the stress. And yes, again, we all took our time, some time for ourselves, what we like to do. And mm, and by everything around was, the people around were so uplifting. And every time, even from, for example, like when my home, I used to come, and they, the way my parents and my brother and everybody were looking up, that boosts up your confidence and releases your stress, and doing you that releases your stress, and that really feels like, yes, this can be coped up, and this can be done, and this is what we are made for. And last not the least, when a COVID positive patient goes home with uh, the person, the COVID patient was utterly diseased, and he had no scope of going back home. And when we all worked, and then he went back home. So yes, that blessing again releases out all the stress. So that's why how we were coping up. And but yes, but for the final years, they had a really hard reality check. I'm sure a lot of people would have thought about it again. Should we be continuing with this or not? But at the end, it's all worth it once you get the blessings from all around, and especially the patients. So that was the only way out. We was coping up with stress.
I'm sure it must be a tough time for all of you out there. And not only you, I guess even the COVID families that would have come with their, whoever the relative is. How did you help them even tackle them? They must be under a lot of stress and pressure. They can't even meet their relative inside, right? I am sure. So how would you help them out and.
At that moment, we were the only people talking to the attendants that time. And we started video call every evening for 1 hour for the COVID patient and the family.
Oh, that's
We never The protocol was made because, yeah, so nursing attending the patient, COVID positive patient, was at the in the evening time, 6 to 7 or 8. They were made sure to talk to the attendant. I mean, the patient was sure to talk to the attendant, and so that attendant was in a sigh of relief that, yeah, my patient is okay. Or else, if something is there, and if the attendant wants to come and see, with proper precautions, in rare cases we did allow them. It was just for their safety, for the attendant safety, not to catch COVID. That was the only purpose for us, for attendance not meeting. And we as managers also did this job also for the COVID patients who are there in the ICU and are critical, because family needs to know what is the condition, and how the further things will go with them. Even, and second wave was such कि हमें जिसमें पता भी नहीं था कि पेशेंट कब की डेथ हो जाए, वो अभी ठीक हो रहा है, डिस्चार्ज हो रहा है, और पेशेंट सडनली कोलैप्स्ड एंड पेशेंट डाइड. So उस टाइम अटेंडेंट का स्ट्रेस वाज अ डिफरेंट level. And handling them and seeing grief all around was something that really made every one of us think back again, that should we be there in the industry or not? Because we, at the end of the day, we all are humans, and we also were, stepping back. But at the end of the day, something, or maybe a, God, by God's grace or God's,
Mhm.
what do you say? I think I'm going out of the question. Next.
Yeah, I'm sure it must be a really, really tough time. I can actually understand by your words itself. It's very heavy. And besides that, it was a lot of myths and superstitions coming in, right, at that point of time. So there were like a lot of people who were falling for these myths and superstitions that were coming all over social media and all kinds of platforms, right? So what would be your take on that? Like, how would you tackle such stuff on the social media, which is spreading all across?
Say superstitions. Yeah, with be it any field or be it any industry, we all have myths, and these were everywhere. But people are not that much well educated. I'll talk in my terms. I mean, in my industry, people are not very well educated about the fact that things are not the same as they believe in myths. हमारे यहाँ पे क्या होता है कि किसी ने कुछ कह दिया, हाँ, हाँ यार, तेरे साथ मेरे साथ भी ऐसा ही हुआ था, एंड दे स्टार्ट बिलीविंग इन दैट मिथ, एंड देन दे विल जिससे कि डॉक्टर तो पागल बनाने के लिए बैठा है, उसको क्या पता है कैसे होता है। एंड दिस इज द रीजन फॉर सिर्फ कोविड के टाइम मिथ्स नहीं है, वैसे भी मिथ्स बहुत सारे हैं, but they are scientifically not they are not proven or they are not there. Myths बहुत ज़्यादा about RT-PCR के रिपोर्ट के लिए भी थे, कि RT-PCR जो है वो सही टेस्टिंग नहीं देता है, पेशेंट इज कोविड पॉजिटिव, हमारे को सिम्टम्स दिख रहे हैं और RT-PCR नेगेटिव दिखा रहा है, सो इसका कराने का कोई फायदा नहीं है। आप एक बार वैक्सीन लगवा लो तो आपको मास्क या सोशल डिस्टेंसिंग करने की जरूरत नहीं है। It was always it's a myth. It was always a myth. ऐसा नहीं है कि आप आपने वैक्सीन लगा ली तो आप 100% इम्यूनाइज्ड हो और आपको कुछ नहीं हो सकता। We all seen example in the third wave कि दोनों वैक्सीन लगी हुई हैं and people are falling again in the third wave. Then सारी कि प्रेग्नेंट वुमेन को वैक्सीन नहीं लगनी चाहिए क्योंकि बच्चे को कुछ हो जाएगा, and it's nothing like that. Pregnant women after clinical trials were proven safe to take the vaccination. Then I would again say last was a COVID a positive woman who's pregnant cannot cannot give the birth, and the baby would be COVID positive, because it was a myth that in the from the mother to the baby it's traveling through uterus. No, there were a lot of cases where pregnant women had delivered the baby and the baby was fine. Baby did not have COVID positive. He was not COVID positive, and baby was pretty normal as we were all born. They were the myths again. Taking vaccination will cause food allergy. No, nothing like that. They're all vaccination is done, coming up with every clinical trial, and clinical trials are done for like 4 phases, and it doesn't come up very easily. Yes, clinical trials they take to time, and everybody just said it again. The myth was the vaccine came so early, it's not effective. No, it's not like that. Humans are as clinical trials and research community, they have overworked to get the vaccine to keep us all safe.
Yeah, rightly pointed out,
So
because
these are
I
the
believe it be a lot hard to tackle, right? Because people have this. Do you believe it's like the psychological mindset of these people, or what is the reason behind all this? Is it because the psychology of the people, or what?
um firstly, this is it was more there in the villages, the rural area, I would say, because of uneducation. Myths have generally there in the rural areas because of uneducation. They even didn't know what COVID was. I mean,
Oh,
for them, it was just something. People are having it, and people are dying. They don't know what is happening with the person. It's uneducation, and in India, we all believe कुछ नहीं है, सब ठीक हो जाएगा. And this myth, these things are prevalent with cancer as well. People never knew what cancer was, and people were dying of cancer. So these generally comes with the rural areas, and psychologically, yes, because not everybody has a medical person at their homes, and everybody has their own set of mind about things and how they perceive. So that is why the myths are more believed in India more than the real facts, because our education system doesn't really much emphasize on these things.
one such myth which all of us, I guess, came across during the second wave was that the vaccines which we got during the COVID vaccine shots which we got were creating some kind of illnesses, body illnesses, or some other kind of problem in a person, which was lowering the immunity when they got normal. So, what is your take on such stuff? Is it true? What is your point of view?
It's not true. Vaccination will never, reduce your immunity. I mean, for example, if we take other vaccination like hepatitis B or tetanus, why do we take them? To prevent the disease and to boost our immunities. So now, basically, what vaccination is all about? We just inject the virus in a live or a dead form with performing with different gene sequencing, so that the body knows it's a foreign body and you need to react.
I
So
agree.
it's yeah. So vaccination, it will never reduce your immunity. It will boost up your immunity and will help you fight COVID more efficiently. See, that is why in the second wave we saw hospitalization less with COVID vaccinated people. There was a study done in hospitals that people who have taken vaccination are hospitalized less and have greater chances of recovery than people who are not vaccinated. And lately, see in the news also, this third wave of COVID is caused by mostly unvaccinated people who did not take the vaccination because of these myths.
Hmm.
There was a myth of getting if you get vaccinated, a woman cannot conceive. So this
Oh,
was all prevalent in the rural areas, and due to uneducation, due to lack of awareness, due to lack of medical facilities. So coming back to the point, no, it doesn't reduces your immunity. It will help you to come out in a better way and fight the disease rather than you getting hospitalized.
right. Truly said, ma'am. We saw in the second wave itself that there was a lack of, there was a shortage basically of medical equipment. There was a shortage of beds. People were fighting for beds, oxygen cylinders, and what all not. So, how did you, as managers, as hospital managers, look into this, and how did you cope up with all this?
um on a पर्सनल नोट, मैंने ना कभी इतना ना नहीं कहा था किसी को फ़ोन पे। जब मेरे को उस टाइम फ़ोन आते थे, I used to get a call for beds. At that point of time, I thought, "Oh my God, I cannot help." I mean, as a manager and as a doctor, I feel. But again, the government, what they did for beds, we all know isolation centers were open. I opened up all my emergency beds for isolation. I converted my parking into a isolation center with 30 beds for only for COVID. I converted whole my floor for COVID. I had to for floor. Then there were tie-ups with the hotels because they had that rooms. They were tie up with the hotels for the isolations. Um, that was that was what we were just trying to deal with the availability of the beds. But when it comes to the managerial part and the doctoral part, so if I just have one bed, and so then on that and I have two patients. So then we on decide upon the clinical how clinically well the patient is and whom to give the bed. So there were prioritization policies that we as doctors and managers made, that what should be done in these situations. So it all depended upon how well the person is clinically, or how bad the person is clinically. So that was one, the availability of beds. Second, we all know about oxygen cylinders. So the industries, they all were converted to the for making oxygen cylinders. But at the same time, that still led to a shortage, because no healthcare system is in the world is prepared for this kind of disasters. So mishaps that happened,
Right.
yes, it happened, but this was our try to then it was the basic medicines, that was they were not there in the pharmacies, in the hospital pharmacies also, for IPD patients also, the patients who are admitted. That was a real challenge, because patient was deteriorating so much, and you never had the medicine for the patient. So at that time, the pharmacy companies were instructed to increase the production and decrease the production of non-essential drugs. Every local pharma company was told to manufacture these drugs, which are which are really needed, and to for the seamless flow of the supply chain. And secondly, hospitals also help, neighbor hospitals also helped for getting up the medicines. And the situation was also such that for me also, if I had to get something for my family members, I even had to fight for getting that drug.
So true.
So we did come up with the situation. We did come up with the situations, and we just as managers, we just expanded our we just expanded where we could, and all the medical equipments, even all the small vendors were, even the tailors were told to manufacture the PPEs for us. That is how, and that's the learning we all got from the healthcare challenges, healthcare pandemic that was there. Now we are more
Oh, I
prepared
got it.
for the third wave than we were prepared for the second wave.
Yeah, because we got an outline as to how things would proceed. But like you rightly pointed out that the production has rised, right? And if we notice before the pandemic, it was really not there, right? Like the healthcare, which should have been prevalent from the beginning itself, for the sanitization and everything, was not there, right? So my question here is that we have seen an upward demand for healthcare at home during COVID. So, do you think that such kind of setups, which we have brought up, and such kind of initiatives that we have taken up for the COVID itself, is effective or not?
It is. See, healthcare at home was, introduced by Dr. Gaurav Thakral, who this was a solution to the non-availability of the beds during,
Hmm.
during the pandemic. So this
Right.
idea came, and for the people who will be sick for long and are bedridden and need some amount of medical care at home and can be treated at home. So this was the concept of how healthcare at home came up. During the pandemic, it was on such a rise that we all never wanted to go to the hospital, right? जो है, we all wanted to be treated at home. We all always wanted to have facilities at home. So four main startups for for healthcare at home played a very important role in
Mhm.
for us dealing with the situation. At the end of the day, it's the bed that is not available. So your the bed at home is available for you, and it is always said that the person who the person who is sick recovers better at home with people rather than being on an ICU bed.
Rightly.
So this really helped us. Many new startups came. This created a lot of jobs in healthcare. I would really appreciate this uh, startup for getting into for creating jobs at the time of pandemic. But again, due to the shortage of nursing and doctors, the
Mhm.
base which were the basic the healthcare at home services and the facilities drained out fast. And it was initially not initially not really accepted in India because of our education that no, the person should be treated in the hospital. So they never came up at that level of for facilities. But during the time of COVID, they also did try their best, but again they were
Mhm.
they were their facilities with their human resource, they ran out really fast.
Yeah, true. So, ma'am, with this, we would be moving to the last question. Now, the house is open to questions. So, guys, you can feel free to ask, ma'am, your any queries regarding the same. So, so the last question, which we all are really curious about, would be the booster dose. We have so there has been some unclarity with regards to the booster dose of COVID vaccine as to whom the booster dose is applicable to and when it is to be taken, and so and so forth. We have controversies regarding the booster dose. So and also we have some controversies regarding the ICMR guidelines. So maybe could you give some a light on the same as to how to go about it?
Yeah, ICMR guidelines for COVID positive people, for COVID guidelines is that we all need to panic first of all for the third wave. It's not dangerous, it's infective. There's a difference between dangerous and infective. It's not dangerous, it's not killing people. No data is there yet. Yes, people with comorbidities, any disease to them is dangerous. So, be it COVID or be it diabetes, it is dangerous. So, we need not need to panic. If you have ever come in contact with a COVID positive person, just isolate yourself for 7 days. And if you get any symptoms, we are getting some symptoms for sore throat sore throat, some cold. There are basic medications for that that needs to be taken, and you need not even repeat the test after 7 days. You'll be negative.
Oh,
If it's at this mild level, just isolate yourself and just be at peace. Do not panic. ICMR says that. So ICMR's latest guidelines is this only: no test, no requirement of RT-PCR, even if you have come in a COVID contact positive patient and you feel the symptoms. You just trust yourself, you're a positive. Just be away from home, be away from people, isolate yourself. Now coming to the booster dose,
mhm.
I have taken my booster dose yesterday itself. So it is the eligibility for booster dose is 9 months by the ICMR guidelines from the second dose. The day you have taken your second dose, it's 9 months.
Fine.
Booster dose is not it's not causing any discomfort. Yes, a bit of discomfort in the area of injection. That's it. And booster dose is important again for our safety. I will again say it's not that key after getting the booster dose we cannot get positive. We all can. So it's upon us how precautions, how many precautions and how cautious are we while dealing with public, or while going to hospitals, or while taking care of yourself. That's it.
I agree totally, ma'am. So thank you, ma'am, for clearing all our queries. And now I'd like to open the floor for the questions that are in the chat box. So, so shall I, ma'am?
Uh, okay. Is
So,
it advisable for children below 12 or? Yeah,
I'll be
sorry.
sure thing. So, when the rates were fixed by the government for vaccine, when they were provided at different cost at different medical institutions, this is a question by Yashten.
Uh, See, the vaccine rates were fixed, and they were, you know, supplied for different rates in the different hospital. That was about the management, hospital management decision, because um, they did not really see, at the end of the day, it's all about the business. Even the vaccination was a business, is a business for the hospitals. So that is why they just and there was no very much strict guidelines against for charging high for vaccines. So hospital had, the top management had its own reasons to charge high. With the government facilities, the government hospital, the vaccines were available at the same rate. Even that happened with the CT scan, HRCT chest. The government had fixed the rate for 2,100, but hospitals were charging 6,800. So there was no as such very strict guidelines or strict action taken away, taken, for the hospital. That was on the upper management.
Rightly. So another question by Hadia Khan would be when can an what can an be done by societies as whole to understand the implications of the pandemic?
Okay. Mm, Implications right now, it's or I would say it's too early to say. We as a community, scientific community, we also don't know about the implications. It's for us also, it's hit and trial right now. I cannot expect the society to know the implications, or do anything unless or until, because everything written in the medical book is uh, seen and researched for at least 50 years, and then it comes in our medical books. So professionals, to as doctors, to say what implication it would have. Yes, definitely life has changed, and for good, I would say, because we all have learned to do hand washing in a proper way. So that's uh, a good positive point that the pandemic has taught the society.
Right, perfect. So another question by Harshit Chopra would be, he wants to understand your point of view on how the new health ministry is responding to the current situation and how are they different from the previous administrations?
Right now, see, from second wave of COVID, we are much prepared in terms of, yeah, medical supplies. The ministry has, taken, proper, even I would say, check on the supplies for basic needs. This is how the, ministry, was has really helped us in, has really helped us from the second wave. Second wave was out of everybody's thoughts, honestly. be it ministry, be it us, be it anything. Every administration failed at that time. Every admin. I mean, everything. But you know, from the ministry has learned good lessons from the second wave, and third wave we are not facing any shortage of beds, oxygen right now. We can see the rise of cases more than the second wave. We are not
Hmm.
facing any issues in medical supplies. We are not facing any issues right now. So this is how the administration of the second wave has taught us in the third wave.
Hmm. So, Dwania Arora has a question for you. She asks, in the end, do you believe that people who are vaccinated are protected from this disease as a whole, or is it simply a means of prevention and not a cure?
uh See, pandemic, this is not, COVID-19 also has a cure, but vaccination is something that it's a means of prevention, not prevention. Yes, it's a mean of prevention. See, it's possible if, typhoid. If you take a typhoid vaccine, it's not that you cannot get typhoid, but as a means of prevention, we do get a typhoid vaccine. See, vaccinations are not 100% for prevention, but yes, 95, 99%, we categorize them as a means of prevention. And cure is something, once the patient is there with the disease, and after that
Yeah,
what treatment is given is a cure.
sure
We do
thing.
not give vaccination to the person who's COVID positive. We only give it after 3 months.
Oh, okay. Muskan Sharma has a question. If I've been vaccinated against COVID-19, do I need a booster dose, booster shot compulsorily?
Yes, yes. Um, the efficiency of COVID-19 vaccination ends in 6 to 9 months, which the recent studies and the research data has shown. Your antibodies, now again, hospitals are doing a research. I'm the part of the research project, that after 6 to 8 months, how many antibodies are there in us, and after the booster dose, how many we would be having. So yes, it is compulsory, because this is again, till the data what we have, it shows the efficiency and the efficacy finishes, and it is necessary for yourself to protect yourself against COVID.
Sure thing. I'll just be taking another
Still
one
more
or two.
research needs to be done, and it's going on in hospitals.
Oh, got it. So I'll be taking another one or two questions. I'm sorry if if I've skipped one or two a few questions for the same. We'll be covering it up in the next episode, I guess. So, ma'am, another question by Vanani Chabra was: Is it advisable for children below 12? Um, is it advisable for children below 12 or 12 to 16 to take vaccines?
Trials are going on. Trials are going on. See, medical professionals, we do not comment on anything before we don't have a data. Trials are going on, and what side effects? Right now, wherever in the world the children are getting vaccinated, there are no side effects being noted or there. In long term, we even also don't know what is going to happen. So it's all something which eventually we know with time. And how would it affect the puberty period? This is something right now is very difficult to answer, because as such we see nothing on this topic.
Right, truly. So, the last question that I'll be taking up from Ayushi Chopra would be, ma'am, do you think that in third wave also there may be shortage of remdesivir and other essential medicines?
No. Now, the government and all the hospital administrations are all geared up,
Hmm.
geared up with the medicines that we were struggling to get in the second wave. It should not be happening unless or until something, uh, another different comes up, the third way, any kind of medicines which would be needed in the treatment of COVID.
True, true, ma'am. So, this brings us to the end of our podcast. Thank you so much, ma'am, for clearing all our queries and everything.